Good morning or good afternoon, wherever you are. Welcome to another edition of MTP, Meet the Penis. For you guys to be joining us today, it's a busy day of news with Stormy and all of the other salacious events going on, like the unorthodox urinals. I'm very happy that you've joined us today. You guys have sent such great questions, and I don't want anybody to feel neglected. And I feel bad. Let me be the one that feels bad. But I'm going to try to blow through three good questions, even though they would all easily deserve a full hour. But I'll blow through these three, and every week I'll try to catch up. And if I miss yours, it's not because it wasn't a great question. So keep submitting your questions, and we will keep doing our best to answer them. Today we have no visiting professors, so you get only one very biased opinion. Welcome to MTP. This one's first from Kenneth. Kenneth said, I have had my prostate removed because of cancer. My question is, would I be a good candidate for this procedure? Of course, you're a great candidate for this procedure. Your urologist will almost certainly exhaust other measures for treating the erectile dysfunction, including pills, shots, and then maybe an implant. One thing that I would advise you to do, and this is our opinion, we're in the middle of putting together our numbers to show that this is supported by evidence-based medicine, but let's say you're 6 months out of your robotic prostatectomy or your cryotherapy or whatever treatment you had for prostate cancer. My advice is you go to somebody that's involved with the Sexual Medicine Society, and they will usually have the ability to perform what's called a penile duplex on you. Now let's say they do this duplex, it's an ultrasound of your penis, and they see that blood is leaking back into your body. There's not a problem with blood flow into your penis. The problem is it's leaking back into your body. These are people that really don't get better. And in general, I like to quote to my patients, and I'm sure a lot of the surgical oncologists would take offense to this, but at least 50% of these guys are going to have veno-occlusive disease, this leakage, and they should really start moving towards an implant, because pills, shots are not going to be efficacious, and all during that time you're going to be losing length and girth. And we will have one very long MTP for this. But Kenneth, I didn't want you to go waiting, because that's the worst thing you can do. Be proactive, get something done. And we will have a full episode of MTP at one of these days. The next is from Angelo, and Angelo was saying, correct me if I'm wrong, but I find that the Coloplast Genesis, meaning the malleable penile prosthesis, is much more simple and undetectable approach versus the Coloplast Titan, meaning the three-piece inflatable. Now, very basic, and like I said, we will have a full episode on this, but I want him to know before he has something put inside him that he's not happy with. The malleable penile prosthesis was the first penile prosthesis introduced into the human body more than 40 years ago. It is not physiologic, but it gives you a penetrating penis. I know one of the docs, he's one of my mentors who developed it, Dr. Carrion, and it is an awesome implant for penetration. It's not very physiologic. It's very difficult to conceal. It's a piece of cake to put in, but you need to look side by side at both of them. Let's say you have terrible hands, awful hands, and meaning you've had a stroke, you have Parkinson's, you have a very difficult time with your tactile sensation. Then I would go ahead and consider a malleable. Once again, go to somebody who's a member of the Sexual Medicine Society, and they should be able to adequately guide you to what would be best for your specific case. And like I said, we'll have a full hour on that at some point. And finally today, just because she sounded so sweet, Romina, she was talking to us about her husband who has a very low libido, and he's in his 30s. Libido is really driven in the male by one hormone, and that's testosterone. It doesn't mean that you can have low libido with a normal testosterone, but testosterone is the driving force for libido. If you go to somebody who knows what they're doing, again, somebody from the Sexual Medicine Society, they'll look at all of the different binding proteins and everything else that could be affecting that molecule of testosterone. They'll also look at other medical problems, other hormonal problems, other medication-related problems that could be contributing to low libido. But I don't think that we need to, and I want to just shut the door that, for some people, once a month is okay, which is what you were told. I'm sure that is the case, although that is the aberrancy. And I love the most recent article that came out that said that if you have sex at least every other day, you are much less likely to have prostate cancer. So that could be a very motivating thing for your husband. So Romina, don't give up. Find somebody who knows what they're doing. I'm so glad that you joined us on MTP, once again, considering all the wonderful, salacious stuff that's in the real news. And here we are doing the real scientific news for the penis. See you next week.